I'm Tony Kensby, a retired physician. Although I'm not a physical therapist, I am an athlete and have experience with hands-on physical therapy. Working with me is my daughter, Judy, who has practiced massage therapy for years. Our aim is an introduction to further videos on self-massage and trigger points. Remember, always start slowly for a short period of time and work your way up over weeks or months. Bear in mind, increasing persistent pain should always alert you to seek advice from your medical professional. For many of the massage techniques in this series, you will need a minimum of equipment: a tennis ball, a massage roller. They sell at Walmart for $15 or less. You'll also need an ice pack of some type and a personal exercise mat, which is optional. The roller is used to lengthen and massage the muscles. We'll start with the calves or gastrocs. Do both legs at once, a few inches from below the knee down to just above the Achilles tendon, and roll back and forth. Do this about 8 or 10 times. With time, you can get up to about a minute or two. You'll see later on, as you get into the massage, you can cross your legs, one on top of the other, and then roll and apply a lot more pressure. I don't advise doing this at the start, as shown in some of the AV videos, because this puts a lot of pressure on the calf muscles. So start slow and work your way up. For the thighs or quads, be sure to roll from your hip to your knee in the center to get the rectus femoris. Then you can turn slightly laterally, get the lateral portion of your quad or the vastus lateralis. And finally, you can move your knee up and rotate internally to get the medial portion of the quad or the vastus medialis. While doing this, you can also pinpoint any tenderness or trigger points. Start with just a few minutes on each leg, and you can work up to about 3 minutes for each thigh, as well as when you roll your calves. Using a tennis ball, we're going to work on the quads. You can also do this for the calf or gastrocs. Slowly move the ball just in maybe a half an inch to an inch up and down, and slowly move upward, up and down, and further upward. And do this in the center, and then go back to the knee and move slightly laterally, and again just moving the ball just slightly. If you hit a tender spot, this may be a trigger point. You'll need some sustained pressure to relax it. So stay on that, moving the ball just a little bit back and forth. I find that cross friction tends to snap at the muscle to move it, and moving up and down along the muscle I find to be more worthwhile and prefer. Stay on that spot for just maybe 6-10 rolls and then move on to another spot. Don't be too aggressive. Most treatment failures are a result of being too aggressive. And you'll usually find more than one spot to work on. Trigger points are knots in the muscle that often refer pain to other areas. Again, some sustained pressure on the trigger point, but no more than about 6 or 12 movements on any single trigger point is preferred, and doing it several times a day will eventually get rid of that knot and the referred pain. Another technique is to use your hands and elbow. Warm up the area first with your hands. Do this to both legs and do it for a few minutes. And then, to save your fingers, take the palm of your hand, using the heel of the hand, rub it forward to the knee along different muscles. In doing this, you may find that you have some sensitive areas, which are called trigger points. Now take your elbow, we'll use it instead of the tennis ball, and rub it, moving down the muscle. We'll be doing this to both legs. When you find a sensitive point, hold it and just move back and forth in one direction, maybe 6 to 8 times, just like we did with the tennis ball. This will help relieve the muscle trigger point. Several times a day for a limited amount of time is better than a prolonged pressure on any of these trigger points. You should ice after a massage, somewhere in the order of maybe 10 or even 15 minutes, to prevent any inflammation from the massage itself. In summary, use a tool if possible to save your hands. Use deep stroking massage, not static massage. Massage with short, repeated strokes. Do the massage in one direction. Aim at a level of 7 on a scale of 1 to 10. Limit the massage to 6 to 12 strokes per point. Work a trigger point a short time, several times a day. If you get no relief, you may be working the wrong spot. Try the techniques in this video and see what works best for you. Remember, increasing, persistent, or severe pain requires attention from a medical specialist.